Hi, today we're gonna talking about the Foley catheter on a female patient. You will start going to the patient room, do your aided, ask for name, date of birth, allergies, for pain. Now you will prepare all your instruments to start the Foley catheter. You will place a blanket on top of the patient so they feel a little bit safe and comfortable. Now you will do high hygiene in the pericare area so you can maintain a clean that area when you are inserting the Foley. When you finish doing the high hygiene, you will start opening your Foley packet. The first thing that you're gonna do is with the Foley, you will see that there is a plastic bag in there, so that you will use it for your trash bag. Now you are gonna start open the Foley packets, so it will be fathers first aware of you, left, right, and then towards you. The first thing that you're gonna see there in the pack in the kit, it will be at something to put in the bottom of the patient. You have to be very careful. You will touch it with the top of your fingers because all of that are sterile. Then you will press it carefully on the bottom of the patient. Now you will start to put in your gloves, your sterile gloves. You put the way as your professional tissue. Now you will see there is another piece of paper on there on the kit, and in my case I don't use it. Now you will start putting the lubricant there in the container. You will open it. Now you will start open the cotton bulbs and the ozone, because with that you will clean the patient pericare area. When you do that 2 steps, now you will go to your tube and you will remove very carefully the type of plastic that is on the Foley, and then you will place it back. Then with the syringe that you will have 10 milliliters of water, you will place it right there in the back of the Foley, of the catheter. You will go to the patient area, to the patient feet with everything, and then you will your non-nominal hand, you will place it on the pericare of the patient. You will place it and you will open the labias of the vagina of the pericare area, and you will your cotton bulbs. It will be 5 in total, so you will take one and it will be fathers labia majora, throw it away. You will take another one, it will be closest labia majora, throw it away. Take another one, it will be fathers labia minora, throw it away. It will be closest labia majora, throw it away, and one is for the center, top to bottom, and then you throw it away. Now you keep your hand there on the pericare. You never move your hand over there. So now the thing that you have to do is with the Foley, with the tube, you're gonna place it on the loop. You're gonna place it on the loop, and then you will say the patient to breathe, because we're gonna start inserting the Foley, the catheter. And then you will start going inside of the patient private area, and then when you see urine, you stop and you go 2 more inches, and then when your non-nominal hand that is placed on the vagina of the patient, you will put your fingers right there in the tube so it doesn't come out, and then with your dry hand you will insert the water that is going inside of the balloon. When you see that all the water is inside, with your hand that is placed on the private area of the patient, you will pull it to see if there is in the right place, and if the water that we put inside is doing the job, that is preventing the tube to come out. And then you remove your hand and you remove the syringe of the tube. Now the bag, you will place it on the bed. You have to place it on the not move side of the bed of the patient, and you place and you say to the patient that you did all the processes, all the steps, you did all your work, and they're ready to go. Now when you have to come to the room again and remove it, you will bring a towel, you will bring the syringe that you used before, and you will bring a biohazard bag. The thing that you have to do first is empty the tube of the Foley. Then when you enter it, you will massage the abdomen of the patient, so any urine that is in there come out. Any rest urine that is in there, we're gonna take it off. So you will massage with your hands the abdomen. Now you will again drain the urine that is in the tube of the back. Now you put the syringe back on the tube, and you will remove the water that we put in there when we came the first time. It has to be the same exact water that you put the first time. So we're gonna remove everything, and then with the towel you're gonna place on the vagina and say to the patient, on a count of 3 we're gonna remove the tube, and you say 1, 2 and remove it right away so they don't feel any pain. And when you do that, just go to the bathroom, measure the urine, throw it away the bag in the biohazard bag, and then just come back to the side of the patient and clean it, organize it, and say to the patient, they ate it back. Thank you so much for letting me do your Foley. If you need anything, just call me. I will be back in 1 hour.